rediscovering, finding, or dealing with intimacy after a mastectomy. Nobody really has answers to this, which is one of the reasons you found as Sexy Survivors. Thank you so much for joining us today on Second Act TV. I'm so happy to welcome back sexual health expert Tiffany Yelverton, the founder of EnticeMe and Sexy Survivors. Tiffany, thanks so much for being here again.
Thank you for having me back. I love this show.
We love having you here. You give advice that people really seek and don't know really where else to get it, because you are so open and honest about the whole intimacy after 50 and all the issues that we go through. And we've got a big one today, one we've never talked about, and one that has actually been requested by viewers, and that is rediscovering, finding, or dealing with intimacy after a mastectomy. Nobody really has answers to this, which is one of the reasons you found as Sexy Survivors. What I want to talk about today is exactly that. What I see there's two distinct topics, then I'll throw it over to you. One is you're in a marriage or in a long-term relationship, you have a partner, and then you have a mastectomy. And how do you deal with somebody who you love? What are the dynamics there? And then the other, it happens to you as a single woman, and you want to go back out and find love. So let me throw it over to you and just guide us on this. How do we approach this?
What we teach in Sexy Survivors and our platform is that it starts with, and with everything that I teach with my clients, is that it starts with loving yourself and loving the body that you have right now. That every part of you tells the story of what your body's gone through. And so we teach women how to really love their new body and to thank it for being there and to learn how to trust it again, because a lot of women feel like their body's given up on them. You know, there are a lot of options for reconstruction and tattooing and things so that you feel sexy still, but it is a big part of what society and ourselves we equate with our femininity.
Well, breasts are totally sexualized, and that's understandable. I mean, men get aroused, looking at breasts. I mean, it's breasts are a big part of sex. I mean, we all know that. When you say that you get to the point of loving it again, I mean, women that are maybe just now going through this, that's hard to imagine, I would think. I mean, I read a lot of accounts of having them remove bandages. The first time I removed it, I didn't want to look down. I mean, there's so much stuff up here that it's hard to imagine you can love your body again. And I'm just trying to be just exactly how I feel about it. I hope that's okay that I ask you questions
Absolutely.
that I question.
So many women tell me that they really avoid looking in the mirror at all, that they haven't looked at themselves for years sometimes. So accepting, it's before you even start loving it, you have to accept it.
Well, when it comes to dating, one of the big, huge questions out there, and I want to hear from our viewers, both men and women, we're going to get to our men in a minute too, is how, at what point, do you come forth and talk about it? When do you, reveal that you've had a mastectomy?
I believe in honesty and upfront, and I think that it's very individual though. So you have to decide, what would you want someone to tell you if you were in that situation, is a good way to look at it. Do you want somebody to tell you up front? Do you want somebody to wait? You meet this person and you decide the chemistry's not there and that you don't want to go forward dating them. Is it something that they needed to know? But I've had, the woman who inspired me to start Sexy Survivors would tell everybody as soon as she met them, she's like, hey, I have stage 4 cancer and you want to date me, that's great. But I just want you to know that that's what you're going into. And as a woman, I would want to know if a partner was able to have an erection if they had prostate cancer. I think it's something that is part of you. And that if you're talking about what's important to you in dating, in relationships, then that's a good time to bring it up, whether it's before you even meet the person or on the fifth date.
Yeah, there was a lot of written about, whether even to put it on your dating profile or not. Some women felt like, yeah, just put it out there and then you don't have to worry about when to disclose it. Or, do you just unnecessarily, run people off, so to speak? And those were the words they used. Also in reference to, is my husband, am I going to run off my husband? Is he ever going to look at me again with the same sparkle in his eye? And yeah, some men, they can't deal with it. And that's it is understandable, because for one reason, I think there's not much help where they can express themselves on this, that I found. Everything was geared towards what women need to do. And of course, I mean, that goes without saying. But for a man to actually express what he might be thinking is almost unheard of, because if he does, he's automatically an asshole.
Well, I think that comes down to your relationship, first of all. We do support the partners also in Sexy Survivors. We have a full module that we work with just the partners, because it is important. And one of the reasons that I'm passionate about this is because women are twice as likely to be divorced during and after treatment than men are when they're going through cancer treatment. So that affects a lot of families. There needs to be more resources, but men also need to seek those out, that there is therapy, there is counseling, there is coaching, and it's okay to feel what you feel, but also know that your wife or partner is going through a lot also.
Yeah.
And to just stick your head in the sand doesn't do anyone any good.
Exactly. Exactly. And I think with men, and again, I really want to hear from our men on this, as well as our women. Have you gone through this? And what was your experience? What I've heard from men is that one of the reasons they don't touch their wife or their girlfriend or whatever is because they're afraid of hurting her, because they've watched her go through something. I mean, you were basically butchered. I mean, it is, it's horrible.
Well, we call it the China doll effect, that the partners are afraid that they're going to hurt them by touching them. And what survivors have told me for years and over again is that they're ready to get back to intimacy and to sex, and their partners are not.
Well, and a lot of women, what I read also again is, that's the last thing you think about is when you're diagnosed. What is this going to do to my sex life? Not everybody, maybe, but certainly that's not where the focus is. It starts coming up again, like you said, but once you're the survivor and you realize how things have changed, and then there's just people dismiss it. It's just, you're lucky to be alive versus, well, what do you care about sex? And our physicians, lots of them, not everybody, there's some wonderful ones out there, but a lot, yeah, they dismiss it, especially for older women.
I've had patients and survivors come to me and say, my doctor said I just needed to get over it, that they're just breasts. And that she's like, it was a lady who was 32 years old, had 2 young children. And she's like, I want to be sexual. I want to have my husband back. He is sleeping in another room. My doctors have dismissed me. My husband's kind of abandoned me. And I want this back in my life.
I mean, some of the stories are heartbreaking. One woman was another blog described how if she was told, if she knew how bad this was going to be in terms of the emotional impact and on her sex life and just on her relationship, she may not have had the mastectomy.
Yeah, 3 out of 4 women, I think, from the Patty Brisbane big cancer survey that they did a few years ago, 3 out of 4 women have severe sexual dysfunction after breast cancer treatment. I mean, it's the same for men. And I don't want to forget about men, because men with prostate cancer, a lot of men will tell you that they wish they hadn't ever had the surgery as well, because that can cause erectile dysfunction. It can cause incontinence. So looking at the big picture, it happens to both genders. We do need to talk about it.
Mm-hmm. Well, and that's where the main issue is. We don't talk about it. We don't know what questions to ask.
Well, sex is so taboo still, right?
Yeah.
Nobody wants to talk about sex, but we all
Right.
came from someone having sex, and
Oh.
it's important. A big chunk of our life is how we feel intimately.
What are the main concerns or questions you get that might even surprise someone with this, like from women or from men, that people tend to be afraid to ask about this?
Well, I think you brought one up that, am I gonna still want my partner, desire my
Mhm.
partner? Women come to me and say, am I am I gonna still be a woman if
Mhm.
I don't have my breasts, if I've lost my ovaries, if I don't have a uterus anymore? How can I get back to having sex that's not painful? Because radiation can cause a lot of damage on the vaginal walls. Chemo puts women through a surgical menopause, a medical menopause. A lot of times women have already gone through menopause and then they're getting a second dose of
Mm.
menopause again that it's not even being addressed.
I mean, one way, thank goodness, but I can't relate to it because I haven't had it. I haven't really had close friends that have gone through it to where I was able to experience the emotional side of it, firsthand on some level. And I mean, I admire what you're doing and what you're bringing to the table. And, we'll have all the information in the show notes on Sexy Survivors, because you're going to be launching a funding campaign or a crowdfunding campaign. So this can be brought into the hospitals and become part of a treatment plan. Tiffany, one question, like getting back to dating and finding love, what is the biggest challenge that you've heard, out there? I mean, you talk to people, of course, all the time. This is your space. What's the hardest part about this?
I think it's the confidence piece of how you are expecting people to react to what you're going to say or reveal. It's about being non-judgmental in situations because, I have to think about myself. Like if a man told me he couldn't ever get an erection, is that a deal breaker? Our bodies change, our bodies are affected by cancer treatment. And so being cognizant of that, but also being aware that a really good person could maybe not be in the body that you're expecting.
Great way to put it. And dealing with the rejection, that there's a lot that was talked about a lot in the literature out there, is dealing with rejection, being afraid of rejection, when the fact of the matter is, in dating, you're going to get rejected anyway. I'm not trying to minimize that by any means, because this is a different type of rejection, but it may, or maybe not. I mean, the chances are that you're going to get rejected. So I guess it's just dealing with, like what you said, don't take it personally, somehow get past that, which is sounds so easy when I say that. And I totally understand that it's not. It's almost maybe, and let me ask you, handling, like expecting rejection without being negative about it. Is that possible?
I look at dating as a sorting process.
Mm-hmm.
So it's like trying something on, like this
Mm-hmm.
person is good, this person, looking and really just looking at it as a sorting process and having
Mm-hmm.
fun with it. But I have clients that have lost boyfriends
Mm-hmm.
because they couldn't have penetrative sex.
Mm-hmm.
And that is really sad to me because sex can be so many other things. There can be so much other fun to be had. And as we age, we need to learn that anyway,
Mm-hmm.
because sex changes, our bodies change.
You brought up a good point, which is we have to redefine what sex is. We talked about that in other segments with aging and sex, and like the erectile dysfunction, the vaginal dryness issues. That what is is sex penetration? And no, it's not. There's a lot of other, maybe even more fun things to do. And again, what I want to reemphasize is that we need to be able to let men express their fears in this too. And I'm not talking about feelings, but being able to share, concerns about this, fears, maybe, they're freaking out about this, maybe not to your partner, but even to somebody else without being told, well, you're just a dick, how can you do that? How could you think about that? You would probably too. I mean, I think we have to be really honest about that. Yes, some men may really be a dick about it, but I think it's absolutely a natural reaction at first, isn't it?
I would think that it's a natural reaction and that it's
Mm-hmm,
okay to have those thoughts and those
mm-hmm,
reactions, and that we need to normalize that, hey, these are things that people think. We don't
mm-hmm,
always think what we really mean, but we
mm-hmm.
also don't always think before we speak it out loud, possibly, especially to a partner. But that's why we have professionals that you can speak
Right,
to. But
right.
also another something that is always good in many different parts of our lives is you can always just write it down and get it out of your head and then burn it and really sit with it. Like, I'm concerned about this. Am I going to love this person? Am I going to be attracted to them after this? And really think about it. Like, are you? What does that mean to you? And then think about all the other things that you do love about the person that isn't physical, that isn't attributed to what the body looks like.
Yeah, and maybe for women, and again, I'll ask you, is not make it a self-fulfilling prophecy that your husband will reject you or that men will reject you because of it. That did come up over and over as well, where men felt like, but it didn't bother me, but the way she changed emotionally, or she went away, she didn't want to have sex, and it's just really, really complicated and very, very sad and confusing.
Well, when you don't have the support as when you're going through treatment to learn how to love your body, what's going to happen when you're not educated throughout the process of what is happening with your body, it's very difficult to accept what has happened. Then there's the whole like, oh, I didn't have a double mastectomy, but I still had a lumpectomy and I'm still feeling bad about that, but I should feel bad because I didn't have to have a double mastectomy. So
Mhm.
there's like a guilt process too there's so much emotional territory that it goes into, and
Right.
we really do address that a lot in our program as well. We teach women how to clear those thoughts out. We use EFT, which I think I've talked about, emotional freedom technique, with tapping and learning some different modalities on how to just encompass of getting those thoughts and belief systems and belief
Mhm.
patterns out
Mhm.
of the body and out of the cells.
Well, again, so many questions, so many things to think about, and I really would like our viewers, please give us input on this. We'd love to hear your stories, and we really want your questions. If you're like me, who is just like floundering here, this is such an important topic. If you have a question that you really want to ask, don't feel bad about it. Just there's no stupid questions on this. If we're going to move this forward, then let's just try to be as transparent as possible. Tiffany, is there anything else you want to say before we close today?
Yeah, I'd love to have the questions, and I'll just even answer them on Facebook Live, but send them to tiffany@sexysurvivors.org. And then that's a separate email than my main email. And then I can just start answering these on Facebook, on Instagram, on your show again, so that we can answer these questions and get people involved in the conversation.
No, that's a great suggestion, and I will have Tiffany's links, of course, in the show notes. So, Tiffany, again, thank you for your time. Thank you for doing what you're doing, and I look forward to another conversation soon on Second Act TV.